Hello, future nurses. So here is our sample questions related to our NCLEX review, and some of these contents were from Archer review. First question. The nurse cares for a client receiving positive and expiratory pressure while being mechanically ventilated. The nurse understands that this setting is used to A. It gives a set of amount of inspiratory pressure. B. Prevent closure of the small airway during expiration. C. It allows spontaneous breaths between mandatory ones. D. Deliver a present tidal volume with each breath. The correct answer is letter B. Positive and expiratory pressure, or PEEP, is used in clients with acute respiratory distress syndrome because of its ability to improve the lung compliance and oxygenation. This is accomplished by adding pressure at exhalation to keep the alveoli open. So PEP is a setting that may be added to a variety of ventilator modes. For the choices A, C, and D, they are incorrect because PEP does not give an amount of pressure upon inspiration. This description is appropriate for pressure support ventilation, which provides pressure when the client takes a spontaneous breath. A client allowed to take spontaneous breaths between mandatory ones is a feature on SIMV and EC modes. PEP does not have anything to do with these tidal volumes, and giving a present tidal volumes with each breath would an appropriate description from the EC mode. For your additional information, when caring for a client on a ventilator, you should be familiar with the following settings. With the mode should include the volume or pressure. Rate should include the number of breaths per minute. Tidal volume, the amount of gas delivered to the client. Fraction of inspired oxygen. The percentage of oxygen given per breath. PEP, pressure added at exhalation to keep the small airways open and mitigate atelectasis. Pressure support provides added pressure when the client takes a spontaneous breath. So next question. The client is admitted to the surgical ward after being treated initially in the ER for a femur fracture due to a motor vehicle accident. The client is being interviewed by the nurse for his surgery when he suddenly reports a sharp pain in his chest, displays difficulty of breathing, and becomes restless. The nurse suspects a fat embolism. Which action of the nurse should take priority? A. Prepare for intubation and mechanical ventilator. B. Administer IV fluids. C. Check vital signs and respiratory status. Or D. Notify physician. The correct answer is letter D. The nurse suspects a fat embolism. The question provides enough information regarding the client's distress and sudden change in his clinical status. Early recognition and treatment are very crucial in this situation. So as a nurse, you should immediately inform the physician to initiate medical intervention. Remember that fat embolism is a potentially life-threatening complication that occurs from long bone fractures that result in dislodging of fat emboli and then travel into bloodstream up into the pulmonary circulation. Symptoms mimic that of a pulmonary embolism. The symptoms of pulmonary embolisms, the client may report chest pain, dyspnea, and may have mental status changes or confusion. Other signs include tachypnea, low oxygen saturation, fever, tachycardia, and low blood pressure. Petechiae or axillary or subconjunctival petechiae are also characteristic of a fat embolism and help differentiate it from other etiologies. You may want to take this down. The triad of fat embolism syndromes are hypoxemia, neurological symptoms, and petechiae. For the treatment, it includes the intravenous hydration, oxygenation, immobilization, and fixation of the fractured limb. In severe cases of hypoxia and neurological deterioration, intubation and ventilation may be required. In choice A, it is incorrect because the client may eventually need intubation and mechanical ventilation depending on the respiratory and neurological condition. However, this is not the initial action of the nurse. Choice B is incorrect because of the IV fluids may be necessary to prevent hypovolemic shock in the client, but these should be done after informing the physician. The choice C is incorrect. There is sufficient information in the question to indicate the client is distressed. The client may need his vital signs checked and monitored. However, this does not priority over informing the physician and starting emergency interventions. Next question. The nurse is caring for a 48-hour-old newborn. Based on the previous shift's report, the newborn has not yet passed stools since it was delivered. The nurse would suspect which condition? A. Celiac disease. B. Cystic fibrosis. C. Intussusception. Or D. Hirschsprung's disease. The correct answer is letter D. Most healthy infants will pass meconium or the first stool by 24 hours, and almost 100% of normal full-term neonates will pass meconium by 48 hours. Failure to pass meconium within the first 48 hours of life may indicate Hirschsprung disease, wherein it is a congenital anomaly resulting in mechanical obstruction due to inadequate motility, or we called it a ganglionosis. Next question. A 70-year-old man in the ICU experiences sudden cardiac arrest. The code team arrives and performs CPR. After about 5 minutes, the patient obtains a return of spontaneous circulation. A carotid pulse is found, but femoral and radial pulses are not. What is the patient's approximate minimum systolic BP? A. 60 mmHg, B. 70 mmHg, C. 80 mmHg, or letter D. 90 mmHg. The correct answer is letter A. Cardiac arrest is the spontaneous cessation of perfusion by the heart. Following a successful cardiopulmonary resuscitation, there is a resumption of sustained heart rhythm that perfuses the body, leading to the return of pulse rate and blood pressure. This is referred to as return of spontaneous circulation, or ROSC. The signs of ROSC include significant spontaneous breathing effort, coughing, movement, palpable pulse, measuring blood pressure, or abrupt sustained increase in end-tidal carbon dioxide. ROSC is detected by arterial pulse palpation and end-tidal carbon dioxide monitoring. When pulses are palpable, it can be clinically inferred that a patient with a carotid pulse has a systolic blood pressure at least 60 mmHg. The one with a femoral pulse has an systolic BP for at least 70 mmHg, and the one with a radial pulse has an systolic BP of at least 80 mmHg. In an advanced trauma life support, or ATLS, algorithms have also used this 80, 70, 60 rule to estimate hypovolemia and triage patients in trauma settings. However, based on a couple of clinical studies, it is felt that the 80, 70, 60 rule tends to overestimate the systolic blood pressure in hypovolemic patients. To prevent underestimating the degree of hypovolemia, ATLS has removed this recommendation from newer editions. Next, a patient is being intubated in the trauma bay after falling from a 20-feet deer stand. The doctor instructs the nurse to prepare intubation drugs. Which drug should the nurse administer first? A. Propofol, D. Vecuronium, C. Succinylcholine, or letter D. Rocuronium. The correct answer is letter A. Propofol. Propofol is a sedative agent which needs to be administered first before a paralytic agent. The answer is in letter B. C and D are incorrect. These are all paralytic agents. Whatever paralytic agent the doctor orders will need to be given after the sedative. The nurse is assessing a patient who reports intermittent tingling and numbness in bilateral lower bilateral lower extremities. Which intervention by the nurse will be most important to prevent injury to this patient? A. Perform Sims-Weinstein monofilament test. B. Refer the patient for a diabetic diet consult. C. Obtain an order for gabapentin. Or letter D. Teach the patient about appropriate footwear. Okay, as you see, the correct answer is letter D. Peripheral neuropathy puts the patient at increased risk for traumatic injury and tissue breakdown since the patient may not notice early skin damage due to altered sensation. Of the options provided, educating the patient on proper footwear is the only action that aims to prevent injury. Related to the patient's altered sensation in the feet. Choice A is incorrect because Sims-Weinstein monofilament test is an appropriate way to test for sensation in the feet and is used to identify risks for neuropathic ulceration. But this assessment tool is not a preventative action. Choice B is incorrect because diabetes is a common cause of peripheral neuropathy that indicates this patient is diabetic and will not specifically address in promoting the patient's safety. Choice C is incorrect because gabapentin is used to improve neuropathic pain and may be appropriate for this patient but will not directly prevent injury. Next question. A patient is about to get a saline pump NG tube inserted. Which position should the nurse place the patient in? A. Supine with the head of the bed elevated 30 to 45 degrees. B. Supine with the head of the bed elevated at 60 to 90 degrees. C. Knee chest position. Or D. Prone position. The correct answer is letter B. A supine position with a 60 to 90 degrees elevation facilitates swallowing of the patient and lets gravity help in the movement of the tube down to the GI tract. Choice A is incorrect because the nurse should position the patient so that the insertion of the NGT is facilitated. An elevation of 30 to 45 degrees is not enough to facilitate the movement of the machine down the GI tract. Choice C is incorrect because a knee chest position does not facilitate the movement of the tube down to the GI tract. Choice D is incorrect because the prone position does not facilitate the insertion of the NGT. Which of the following is a neurological complication that may occur when a vest restraint is too tight around a patient's body? A. Skin breakdown. B. Strangulation. C. Changes in skin pallor. Letter D. Numbness. The correct answer is letter D. Numbness. The neurological complication can occur when a vest restraint is too tight around the client's body, causing numbness and tingling that, unless corrected, it can lead to neurological damage. The A, B, and C are incorrect because skin breakdown, strangulation, and changes in skin pallor can occur when the restraint is too tight. These complications are usually related to the integumentary, respiratory, and circulatory systems rather than the neurological system complications. The nurse has been assigned the responsibility for all aspects of providing patients care during a 12-hour shift. How would you classify this approach to nursing care? A. Team nursing. B. Case management. C. Total patient care. Or letter D. Primary nursing. The correct answer is letter C. Total patient care model. The RN assumes responsibility for all aspects of care for a patient or group of patients during a shift. Although care can be delegated, the RN works directly with the patient, family, and healthcare team members. In choice A, this is team nursing. The RN leads a team consisting of other RNs, licensed practical nurse, and NAPs that provide direct patient care under the supervision of the team leader. Choice B is incorrect because case management is an approach that coordinates healthcare services, linking patient or family to the needed services. Rather than providing direct patient care, the case manager typically supervises the care provided by the healthcare team. Choice D is incorrect because in primary nursing, the RN is assigned responsibility for a caseload of patients, developing a plan of care and providing care for the workload of patients throughout their hospital stay. While working in the newborn nursery, you are called to L&D and asked to assign the Apgar score after birth. When you evaluate the infant at 1 minute of life, you find the following: pink body with blue extremities, heart rate of 90 beats per minute, loud cry when you flick his foot, actively kicking his feet, and a vigorous skull. What Apgar skull do you assign this patient? The correct answer is letter C. The Apgar score is 8. For the Apgar scoring, I will send a picture for you to easy to understand. Thank you.